go back to your country. You go back to your country. It's hurtful. Abantu kuramaphosa. Abantu kuramaphosa lohlala naye endlini yakhe. Abantu.
So guys, basically this lady is expressing her frustration to the illegal foreigners and saying that these illegal foreigners must go and stay with Ramaphosa in his own home. And guys, I did say that this is a ticking time bomb. It's only a matter of time before South Africans actually go out in the streets in their numbers to protest this mess that is happening in our country, because I don't think that any of these people that are abusing the resources in this country would actually allow what is happening in South Africa to actually happen in this country. And this is the reason why we are so tough on this government to say, these people, guys, that you have allowed to come into our country and to abuse the resources of our country, their governments will never allow anything like this to happen in their own countries. So why is the South African government actually allowing the mess that is happening in this country to continue happening? Excuse me. I don't understand. I actually don't understand. Why is the South African government allowing the illegal foreigners to come in this country and abuse the resources of this country? And everybody says that the resources are limited. We don't have enough resources to cater for everybody else. But somehow this is a message that does not sink into these people with their thick skulls there in the government. We have a president that is completely inept. We have a government that is corrupt to the core. And while South Africans are struggling, these people are busy eating nice. They are living in gated communities when they expect average South Africans to accommodate the people that are in this country illegally. When is enough going to be enough, guys? I don't understand. When is enough going to be enough?
We cannot maintain the whole of Africa. When you check the whole of Africa, if you go to school, you must pay for yourself. If you go for a clinic or a hospital, you pay for yourself. Why only South Africa? Out of 53 countries, it has to be a free-for-all. And we are the ones who are paying tax. Sarah Ramaphosa and that criminal minister of police, they are stealing our taxpayers' money, all of them in the parliament. All of them, they are stealing our taxpayers' money. We must fork out our money and maintain the whole of Africa. We cannot maintain the whole of Africa. If they think we are causing xenophobia, they must go back to their countries.
Exactly.
We don't want them anymore here. We fought with the white people for a very long time. Today, the very same economy, it has been inherited by the foreigners. We, the bona fide South Africans, we are not enjoying the economy that we fought for with the white people for a very long time. So for now, if somebody feels that South Africans are us anymore, these girls who are sleeping with foreigners, they must never think they're going to control us. This is our country. We fought with the white people for a very, very long time with the white people. So all of them, they must go. And the Section 13 of 2002 is clear. People who should come here are those who are possessing rare skills. And the second people who are coming here, they must have 5 million plus. This goes to 30 million of foreigners. They don't have all those things. So now we must accept that those people, they must come and stay here and we must maintain them. No, we cannot maintain them. They must go to the nearest there.
I mean, like, guys, it makes no sense at all. Like this whole thing that is happening in this country, like, it is so unreal. Every day when I look at this situation, I'm like, what the hell is happening in this country? What the hell is happening in this country? And I'm so over people calling South Africans xenophobic for simply expressing their dissatisfaction with the mess that is happening in the country. I don't care if you call me xenophobic, and I know that a lot of South Africans are totally over being called xenophobic, especially by these political parties, the mainstream media, and these illegal foreigners of theirs. The only thing that actually annoys me is that hardworking South Africans that are earning less than 10,000 rands, most of the people that are working in this country, they are earning less than 10,000 rands. These people are taxed to death so that they can maintain these people that are in this country illegally. Right now, we have South Africans that are dying because they are not getting assisted in our public clinics and hospitals. Why are these people not getting assisted? Because they stand in line. They are forced to stand in the queues with the illegal foreigners. They are forced. And sometimes these people are cut and told to come tomorrow. And you know what happens? Some people actually die. Some people actually die as the result of that. I mean, a couple of days ago, guys, you remember that there's an accident that took place there in Limpopo, and it was also reported that 43 people unfortunately died in that accident. It is sad, man. You know, every time when people die, it is sad. But now, the Road Accident Fund is coming out to tell South Africans that, yes, we are going to give these people millions and millions of rands. Your tax money is going to these people, most of these people that were illegal in this country. The Road Accident Fund says that no, illegal foreigners will be paid millions in compensation after Limpopo bus crash that killed 43 Zimbabweans and Malawians. Your tax money. We are talking about your tax money. The Road Accident Fund has reaffirmed its legal obligation to compensate foreign nationals, including undocumented immigrants, illegal immigrants, following the Limpopo bus crash that killed 43 people, mostly Zimbabweans. This follows a 2022 High Court ruling that prohibited discrimination based on immigration status in road accident fund compensation cases. The Road Accident Fund spokesperson Mpulela confirmed the fund's position in an interview on SABC. I'm going to play you that small clip, guys. He confirmed the fund's position in an interview on SABC News amid growing public outrage after the October 12, 2025 tragedy. The bus, which had been traveling from Gqeberha to Zimbabwe and Malawi, reignited debate over the fairness of payouts to foreigners while South Africans wait for years for their claims to be processed. Hello, boy. So, of course, there are South Africans that are already frustrated with everything that is happening because there are people that are sitting at home. These people, they have been in accident for years and they haven't been paid. But now you have the government coming out and saying that, yes, we are going to pay these people. Like these people, these illegal foreigners, we love these illegal foreigners. We're going to pay them so fast. And now South Africans are saying, wait a minute. A lot of people have been waiting for a very long time to be paid by the Road Accident Fund. But how can you guys now come out with the statements and telling us that it doesn't matter that these people were in this country illegally or illegally, but you will cough out millions to pay these people? What about the South Africans that have been in the waiting list for all of these years? This is what we say every time when we say that South Africans are literally being replaced in their own country. It is literally happening. It is literally happening. That's why I cannot allow words like xenophobia to come and affect. That's why I cannot allow words like self-hate or Africa hate to come and distract me, because right now we are literally seeing our country crumbling right in front of our eyes. It is happening. It is happening. The South African government, they have never addressed these people that have been waiting for years for the payouts from the Road Accident Funds. But now the accident happens a couple of days ago, and now the Road Accident Fund is immediately out telling you that they're going to cough out your tax money to pay for these illegal foreigners that were in this country. It is a mess, guys. It is a mess. Pulela expressed frustration, saying that the Road Accident Fund's hands are tied despite the Immigration Act restrictions on dealing with illegal foreigners. He said the fund must comply with the 2022 judgment, which ensures equal access to compensation for all individuals injured within South Africa's borders. Don't take my money, boy. Don't take my money. Yeah, don't take my money. In 2024-2025 financial year, the Road Accident Fund paid 546 million rands to foreign claimants. R500 million rands to foreign claimants. The figure has fueled public anger, with critics saying the system disadvantaged citizens. The ongoing debate reflects the growing tensions between South Africa's constitutional obligations and public sentiments towards undocumented migrants. Man, it is illegal foreigners, man. Don't stop saying they're undocumented migrants. It is illegal immigrants. it is illegal immigrants. So I want you to hear, guys, from yourself. I want you to hear for yourself what the Road Accident Fund says.
This issue around what the RAF's obligations are insofar as it helping specifically foreign nationals was recently ventilated in court. I think it was in 2022. And then I think it was the High Court that found that, in fact, there is no discrimination according to immigration status. Would that be the case even in this particular scenario?
Unfortunately, it will be. You're mentioning the...
I mean, guys, so do you think that if you were to be in Zimbabwe, if you were to be involved in an accident in Zimbabwe, do you think Mnangagwa and ZANU-PF would cough out millions to pay you? It is never going to happen. It does not make any sense. It does not make any sense. And that's why I said the other day that I actually think that some of these African presidents, I'm sure they are looking at Ramaphosa as a fool, as an idiot. Hey, boy. Yeah. They are looking at Ramaphosa as an idiot to say, why is this guy bending backwards to accommodate our people that we ourselves are struggling to take care of? We have failed to take care of our own people, but at least we have an idiot in South Africa that is willing to take care of these people. I'm sure this is how these people are actually talking when they talk about the South African government, that South African government is full of idiots that are willing to bend backwards to accommodate us. They don't care about their citizens. They call their citizens illegal, xenophobic. They even invite the illegal foreigners to go to the mainstream media to insult the South Africans that are paying for everything that they are enjoying. We have never seen a bunch of idiots. These things, guys, that is happening in South Africa, you will never see these things in other African states. And the time is going to come where South Africa will not be able to provide these benefits to these people. They will leave this country. And you know what is going to happen? Some of the South Africans will try to go to their countries, maybe to try to find a better living. And the South Africans will learn the hard way. South Africans will learn the hard way. Not so long ago, guys, not so long ago, in Zimbabwe then, a South African was sick in Zimbabwe. They refused to give that person medical treatment. And the premier of Limpopo, she had to send out a helicopter to go and fetch that person because they didn't want to even give him a panado to say, no, you are a South African, you are in Zimbabwe, you are sick. We don't want anything to do with you. But in this country, South Africans is treating millions and millions of Zimbabweans on South Africans' taxpayers. How is it fair? How is it fair? I don't understand. How is it fair that South African taxpayers are forced to take care of the people that are not even taking care of South Africans in their own countries? How is it even fair?
This issue around what the RAF's obligations are insofar as it helping specifically foreign nationals was recently ventilated in court. I think it was in 2022. And then I think it was the High Court that found that, in fact, there is no discrimination according to immigration status. Would that be the case even in this particular scenario?
Unfortunately, it will be. You're mentioning the courts. We have mentioned time and again that as a country we shouldn't be paying for foreigners, whether they're here legally or illegally, period. Now, when we have foreigners coming through, there's a couple of things that we have insisted in the past. We have insisted that you bring your passport for us to see, number one, that you're here illegally, but also to determine whether when the accident happened, you were indeed in the country, South Africa. Now, we have had fights with these courts in that they have pushed us to essentially break the law, because the Immigration Act is very clear when it comes to foreigners in that it says that we are not allowed as an institution to be doing deals with foreigners as pertaining to the illegal foreigners. But we have this very peculiar situation where the judges are saying every foreigner is here, even if illegally, but they are here constitutionally. We don't want to pay them, period. If it was up to me, up to the Road Accident Fund, we shouldn't be paying people up from outside the country, but we are compelled by this nanny constitution and the judges.
Man, this Navy constitution of ours is nonsense, man. It's rubbish. It's rubbish. And guys, I heard that the bus, I actually heard that the bus, this is what it looked like. Apparently. Yo, guys, my son has flu. So, guys, apparently this is what it was like in the bus.
I come here, first I wanted to, on
Excuse me.
Saturday, I come here and with my brother and with his wife, to take a bus from here to going to Malawi. And the other people, but we said that as we hear that that bus we have only 8 people, we ride that bus is 61 people, passengers. According to now, we're hearing that those people is 90-something people, which means
It was overloaded, man. Overloaded. Just look at these buffoons just walking over people's heads.
that bus is now is overload. I come here with the other people to want to confirm how is it going on and where is it now. According to the numbers, it's a lot of numbers. First time, first time we're hearing that one children is only that one. Now,
So, guys, now your tax money will be paying these people. Now your tax money will be paying these people. This is how crazy it is. Like, it is insane. It is absolutely insane. And the fact that we have a government that is willing to do everything to accommodate the people that are in this country illegally, like, I actually do not get it. I actually do not get it. I remember this video of Dr. Aaron Motsoaledi telling us what happened to him. Just listen to this. Just listen to how South Africans are treated outside.
Yeah, with the state visit with the president, I fell sick during the middle of the night. 2 o'clock, they took me to Nairobi Central Hospital, which is a private hospital. I saw it alive there and kicking. Firstly, they told me, we don't take South African medical aids, even though I've got one of the most expensive medical aids. Now there's a young girl next to my bed with a speed point. With a speed point. Fell sick during the middle of the night. 2 o'clock, they took me to Nairobi Central Hospital, which is a private hospital. I saw it alive there and kicking. Firstly, they told me, we don't take South African medical aids, even though I've got one of the most expensive medical aids. Now there's a young girl next to my bed with a speed point. With a speed point. Yes, I'm telling you what happened to me in Kenya. I know it's happening in South Africa. But when I saw it in another country, it was very funny. And she said, Minister, the doctor said we must give you an injection. Can you swipe, please? Yes, I took my, debit card. Then I was given an injection. She came back 30 minutes later. Minister, the doctor ordered a drip. We want to put a drip on you. Can you swipe, please? Yes, I swiped for the second time. Third time, they bring another young girl. They said, this is a physiotherapist. Because the problem was the sole of my foot. They said they are going to measure it and put you a pad and all that. Can you swipe, please? I swiped for the third time to get that health care. Meaning, if I did not swipe, no health care. That is the disaster that is in our continent.
Yes, this is how they treat South Africans outside. This is how they treat South Africans outside. And speaking about this accident that took place in Limpopo, now he wants to give me. Speaking about this accident that took place in Limpopo, it was also reported that a lot of medicine was actually found. You know that there are those rumors that these people are stealing the medication in this country. And some of the supporters of the illegal foreigners, they said that it is a lie. There's absolutely nothing like that. But in the same bus that was involved in an accident, a lot of medication was actually found. And this is not the first time that we are reporting about South Africa's medication actually crossing the borders. I remember even the minister in the presidency, Khumbudzo Ntshavheni, was speaking about this to say that, man, it is said that things like the ARV were actually found in that bus. So you can actually think about the South African patients that actually needs the ARVs, that no, some of them, they are not going to get these ARVs because they have crossed the borders to Zimbabwe and Malawi. And as South African taxpayers, this is something that we must just sit down and take it in. We must just sit down and take it in. So right now, the Minister of Health, Aaron Motsoaledi, apparently he's furious. Apparently he's furious about this issue, and I want to go through this article with you guys so that you can understand where the mind of the minister is. So this article says that Dr. Aaron Motsoaledi is furious over foreigners abusing South Africa's clinics, saying unsynchronized systems led Zimbabweans stockpile ARVs to smuggle home. The health minister, Dr. Aaron Motsoaledi, has condemned the patients who abuse the public healthcare system by visiting multiple clinics to collect duplicate medication. His remarks follows the discovery of boxes of ARV scattered at the side of the fatal bus crash in Limpopo on Sunday. Motsoaledi revealed that some patients, including foreign nationals, manipulate the fragmented health system by obtaining extra medication from various facilities. He said a lack of national synchronization allows people to repeatedly collect treatment without being flagged. I mean, we did say that these people are stealing the medication in this country. We did say, and they called us xenophobic. There was mountains and mountains of evidence showing that these people are actually stealing our medication. But they said that no. They said that no, you guys are just being xenophobic. But right now, we know that stockpiles of ARV and other medication were actually found in the in that Bashkra site. Yes, boy. The minister highlighted that Zimbabwean nationals. The minister highlighted that Zimbabwean nationals often stockpile ARVs to avoid frequent travel, collecting up to 6 months worth of treatment instead of the standard 1 month supply. He warned that the practice causes shortages and strains the country's public healthcare resources. I mean, of course. Motsoaledi called for an unified digital system linking all health facilities to prevent duplication. He described the practice as reckless and damaging, stressing that it endangers consistent drug availability for patients who depend on the public healthcare sector. Just listen to that, guys. So some of these people are stealing the medication because they don't want to come to the clinics many times. So they will be like, okay, let me steal these ARVs worth of 6 months. Just imagine, man, stealing the ARVs worth of 6 months. This is what South African taxpayers are paying for. And apparently, if you dare try to say anything, you are xenophobic. You are xenophobic. So what now, guys? What now? We have the South African courts that are saying everything that these illegal foreigners are doing is fine. We have the road accident fund that says that we will pay everybody that gets involved in the accident in this country. We don't care if these people are in this country illegally. We don't care if they are stealing your medication. Now we have the Minister of Health that is standing there shocked and speaking about we need to ensure that these people do not steal more medication. These are the consequences of open borders. These are the consequences of open borders. It is sad, guys. It is sad that this is what we have to deal with as South Africans. It is absolutely sad. And now South Africans are being told not to say anything. I don't know, guys. Please tell me in the comment section. Don't forget to hit the like button and the most important part, subscribe. My name is Thomas Maba. Yeah, subscribe. My name is Thomas Maba. So I'll see you next time. Bye-bye.